Dear colleagues, my name is András Kubik. I'm a urologist. I'm the first year PhD student, and my vision is to empowering patients through excellence in the care they receive from me. And my mission is to provide high quality care for people with urinary bladder cancer. So these are my two topics regarding bladder cancer, prognosis and survival. The first one was investigating MMP7 as a prognostic biomarker in urothelial carcinoma. And this is a combined registry and a meta-analysis. Regarding urinary bladder cancer, it's very important that this is the second most common urinary bladder malignancy, with more than 200,000 deaths globally annually. And most of the cases will be diagnosed with non-muscle invasive bladder cancer. And for these patients, the prognosis is very good, with 95% overall survival. But in about 20% of the cases, there is muscle invasive bladder cancer. And for these patients, the gold standard treatment is radical surgery, radical cystectomy, lymphadenectomy, and perioperative chemotherapy. And despite the radical surgery, only half of the patients will benefit from this type of treatment, and the other half will rapidly progress and die within 5 years. So there is a huge need for prognostic biomarkers, and our aim was to assess the prognostic role of MMP7 in urothelial carcinoma patients. And why matrix metalloproteinases? They are proteolytic enzymes which include cellular induced cellular processes, and they support angiogenesis, apoptosis, and these functions suggest that these could be very good for diagnostic, for prognostic biomarkers, and for therapeutic targets. And it has been shown in the literature that elevated tissue, serum, and plasma levels are associated with lymph node metastasis, and high serum levels are prognostic factors in urinary bladder cancer. And in former studies assessing more than 400 proteins, MMP7 was among the top 5 proteins which had prognostic value. So we drafted 2 questions, one for the clinical registry, and that was the following: do patients with elevated MMP7 levels have worse overall survival rates? And we used the PICO framework, and the 2 comparator was preoperatively measured high and low levels of MMP7 levels, and the main outcome was overall survival for these patients. And we hypothesized that muscle invasive bladder cancer patients with lymph node positive disease and high MMP7 levels have poorer prognosis. So we implicated that MMP7 helps to find optimal treatment for high-risk bladder cancer patients. You can see our 2 registries. The one is with more than 80 patients from Essen, Germany, and we measured the preoperative and the postoperative MMP7 levels. And the second one was from Semmelweis University regarding more than 60 muscle invasive bladder cancer patients, and using the ELISA method for measuring these levels. For the meta-analysis part, we drafted the following question: can MMP7 serum and plasma levels predict disease progression in urothelial carcinoma? With the same PICO framework and preoperatively measured high and low MMP7 levels, we hypothesized the same. MMP7 serum and plasma levels are prognostic indicators of urothelial cancer patient outcomes. So we selected, after duplicate removal, 233 articles. We went through title and abstract selection, and we had 6 eligible full text, in which the main outcome was overall survival. And regarding the preoperative high MMP7 levels, it was 2.69 times higher probability of mortality for these patients. That means this hazard ratio is mathematically significant and clinically relevant. So Summarizing the data, our strengths are that this is the first meta-analysis in this topic, and additional post-hoc analysis was performed with our own data, and this is a quite homogeneous population. We have our limitations as well regarding these limits of enzymes and something. There are different cutoff values, but we had our cutoff value about 7 nanogram per milliliter. It can be measured in serum, plasma, urine, and etc. But we measured it in serum and plasma, and these were retrospective studies. So these measurements could be used in the daily routine. MMP7 has a prognostic value, and we can detect lymph node metastasis in muscle-invasive bladder cancer patients. They should invest in biomarkers, based RCTs, and the implication for practice would be that use prognostic predictive biomarkers for therapy optimization. We published our article in International Journal of Molecular Sciences with 6.2 impact factor, and that was a D1 journal. The second topic is regarding small cell bladder cancer, and this is a treatment showdown regarding this very rare bladder cancer, and we performed a systematic review and the meta-analysis, and our aim was to find the optimal treatment for small cell neuroendocrine carcinoma patients. You have to know that it's a very, very rare entity, and these patients and these disease metastatize very early, and these patients have very poor prognosis. And that's why we choose the non-metastatic patients. We can suggest the best treatment for them. And as you can see in the guidelines, there is no strict treatment suggestion for these patients. And only these procedures are suggested, either radical cystectomy and perioperative chemotherapy or bladder-preserving concurrent chemoradiotherapy. And this is similar to the limited stage small cell lung cancer, and the staging system is the same like for lung cancer patients. So we drafted the following clinical question: what is the optimal treatment for patients with non-metastatic bladder cancer, small cell bladder cancer? PICO framework was used, and the two comparator was radical cystectomy and perioperative systematic therapy, and bladder preserving and concomitant chemoradiotherapy. And we hypothesized that radical cystectomy did not influence overall survival in patients with non-metastatic disease. So we had more than 1,600 articles, and at the end, 5 articles for data extraction. There was a problem with the outcomes, but we choose overall survival as the main outcome, and we selected all the relevant Kaplan-Meier curves, and we extracted the data from there. And as you can see, looking through the data, there is no significant difference between the two therapies. So we are moving forward. We would like to finish our article and publish it, and we would like to say that there is no superiority of radical procedures in cases when there is a small cell bladder cancer patient with non-metastatic disease. So thank you very much for your attention. And the quote is from Wayne Gretzky: "You miss 100% of the shots you never take." So thank you very much.
Thank you so much for the excellent presentation. I would like to ask that which subgroup of patients we should measure the MMP7 level that you recommend?
Thank you. So this is for muscle-invasive bladder cancer patients, and after surgery, if there is no detectable lymph nodes, or it cannot be detected with the CT scan during the staging procedures, that MMP7 should be measured. And if it's elevated, then these patients who are after these surgeries can get earlier chemotherapy or immunotherapy, and we can win 3 to 6 or 9 months with an earlier chemo or immunotherapy. So it will be very, very useful for this kind of patients. That means massive invasive bladder cancer without detectable lymph node metastasis, but we hypothesize and we know that there could be micrometastasis, and if we can prove it with a biomarker, then we can give them earlier chemotherapy. Okay, so this will be the main.
Thank you. Congratulations for your work and progress. I have a question regarding your first project. Maybe you mentioned, but I've just missed it. How did you measure the MMP7 levels in your department? What is the...
Yes, this is from serum and plasma, and the ELISA method was used, so with ELISA.
First of all, I mean, you have a published paper after 9 months, so this should be a good example to everyone, actually. Congratulations.
Thank you.
Second, so now you have a biomarker for prediction. Is there any way that you could actually treat these patients in a different way? So is there any specific targeting in those when the MMP7 is increased?
Yes, this is for prognostication, so not for diagnosis, because we have the diagnosis.
Yep.
And if the pathologist or the radiologist says that there are no metastases, there is only this bladder cancer which was treated and healed the patient, and we have to wait till the progression. So it looks so that we operate a patient, he or she gets neoadjuvant chemotherapy, then radical procedure, and if there isn't any metastasis, then we are thinking that the patient is healed, and we are waiting. We are controlling in 6 months the metastasis or the progression, or we perform staging CT scan. But if these biomarker levels are elevated, then we can suggest, or we can say that these patients have to get earlier immunotherapy after the radical procedure. So with these, the patients can live longer. I had a few patients with this problem, and I saw them that we were waiting, and there were metastases but not detected, and we lost time.
Yeah. I mean, I think this is very important because, I mean, publication is important, but also, I mean, this is for patients. I mean, because you already have the implementation then of your data too.
Yes,
so maybe next year we will show your face. See, I mean, there's the outcomes. I mean, the important direct outcomes of the
my face and my colleagues' face.
Of course.